Welcome back to Champions of Care. We're talking about sleep disorders today. With me in the studio is Dr. Sheila Ray. Dr. Ray, you're an otolaryngologist practicing in Southgate. Welcome.
Thank you.
Now tell me, that's a big word, otolaryngology. What exactly is that?
That is a fancy term for ear, nose, and throat specialist.
So we used to just call you an ENT doc, but
That's
now you're an otolaryngologist.
Correct.
Now I understand we're seeing more and more sleep issues with children. Tell me about some of the causes that are bringing children into your practice.
Children can have a variety of different reasons than adults for having sleep apnea. Their tonsils and adenoid are often much larger than an adult. They have a smaller airway, and therefore that can become obstructive, and they develop sleep apnea.
How do you treat the issues for children?
In children, if the parents are often very in tune with their children's sleep patterns, and they will come in and voice a concern that their child is stopping breathing. If they feel that is occurring, a sleep study will determine whether they are having apnea or not.
Now what about if a child snores? Would snoring ever be normal in a child?
Children can snore for a variety of reasons as well. Allergies, if their nose is congested, anything that obstructs the airway. Adenoid tissue also obstructs the airway. Children have a tendency to have greater upper respiratory infections, and their tonsils and adenoid are often much larger because of that. If it's obstructed, then they may snore. It doesn't always mean it's a problem, but if they're having apnea with it, then it is.
And would the causes of snoring that you just described in children be the same causes for why adults snore?
Not always. Obesity is more prevalent now than ever, both in children and adults, but in children that is one of the reasons, but in adults that's more commonly the reason. Tonsil and adenoid hypertrophy is less commonly a cause for adult apnea.
Those of us who are married may learn we snore from our partner. What about folks who don't know that they snore? What would some of the symptoms be that they would experience the morning after a really bad night's sleep?
If they're having sleep apnea, they would have the sensation of having difficulty waking up in the morning, tiredness during the day. They may take a nap in the middle of the afternoon, feel sleepy when they're driving. In children, they are often difficult to arouse in the morning, and similar to adult symptoms.
So when someone calls you up at your practice in Southgate, and they're saying, I'm just having trouble sleeping, I think there might be something wrong with my ear, nose, throat. How do you sift through the potential problems to find out what's really wrong?
Number one is a good history, which they will often be able to relate to you symptoms that, that when you ask them that point to sleep apnea. I can often tell also by the physical exam of the patient's throat and oral cavity if they have a very low soft palate, if they have adults can have tonsils if they have large tonsils, if they have a large tongue. Those things may indicate that that patient is more likely to have sleep apnea, and I may question them even if they're there to see me about their ears or some other ENT problem.
So if someone's watching right now who is suspecting that they're not sleeping well, what advice would you give them to check it out?
I think to start with their family physician. Often the family physician can pinpoint some of these things as well, but a sleep specialist, and either a pulmonary physician, ENT, or a sleep specialist can determine whether a sleep study is required.
And you are one of those ENTs that we know as an otolaryngologist. Dr. Ray, people can find out more about you and your training and background by visiting your page at oakwood.org. But I want to thank you so much for helping us understand snoring and other things a little bit better. Thanks for being with us.
You're welcome.
And when we come back, we're going to dig even deeper into this issue of sleep apnea. So stay tuned on Champions of Care.